Good morning. The plan is to pre-record my webinar on the kidney, which is scheduled for tomorrow, Monday, February 27th at 6:30. And so let's get right to it. So we're going to talk about kidney stones and urine. So this is a topic that honestly could take days just on kidney stones, just on urinary tract. This is a very brief overview designed just to get people up to speed on why your kidneys are important, what are the major things we kind of look for, not nuances. For those of you who don't already know me, I'm Kathleen King. I'm here to share public knowledge about medical information. I don't give specific medical advice. My goal is to provide additional knowledge and clarification so you can have more meaningful discussions with your doctor or your care team. I have no financial relationships to disclose. I do run my own company, reliablern.com, where I do help people to advocate for their better health. And I do use my own platform at this point, but Liz Saunders from Wiser Health and Fitness, I have a number of repeat customers or people who watch these webinars from Wiser Health and Fitness. So it's a great platform if you ever want to check it out. Kidney facts, standard kidney facts. Okay, so the kidneys filter anywhere from 120 to 150 quarts of blood daily. If you're like me, I don't think in quarts very much. That's 32 to 38 gallons. 32 to 38 gallons. Think of a gallon of milk and think of 38 of them. That's what goes through your kidneys in a day. It removes waste products from the body, balances the body's fluids, regulates blood pressure, in part because it regulates our fluid. So by regulating our fluid balance, we regulate blood pressure. Direct production of red blood cells. So it actually directs the need for more blood cells. It takes away bad blood cells, things like that. So we kind of, there's hormones through the kidneys that are going to direct the production of red blood cells. Activates vitamin D. We need vitamin D for our bones. That's a great thing. Unfortunately, more than 1 in 10 Americans have chronic kidney disease. Not acute, but chronic means they have kidney disease that is progressive and pretty much not curable. More than 100,000 Americans are waiting for a kidney transplant because their kidneys are so bad they actually need a kidney. Heart disease is still the #1 cause of death for people with chronic kidney disease. It's also the #1 cause of death for all of us. And more than 350,000 Americans are undergoing dialysis treatment every year. That's a lot of people on dialysis. All right. In terms of what are kidneys? Kidneys, they're 2 bean-shaped structures. They're about the size of a fist. If you could imagine them sitting behind your back, kind of on either side of your spinal column, below the rib cage. They tend to lean towards the posterior, the back of your midsection. Healthy kidneys, we say, filter about half a cup of blood every minute. Removing waste and extra water makes urine. Urine flows from the kidneys to the bladder through 2 thin tubes of muscles called ureters. And there's one on each side of your bladder, right? So one from each kidney, and both meet in the bladder. So here's a better picture of that. You got the bladder at the bottom, the kidneys at top. Notice you do have these big blood vessels going towards your kidneys. You need that kind of blood supply for your kidneys. Your kidneys, like your heart, are looking for high volumes of blood and a pretty good blood pressure. On the right-hand side, you're looking at tubules. So inside the kidney, if you look at that small cross section of the kidney, there's a bunch of tubules that kind of, notice that they like wrap around. They almost have a squirrely pattern. That actually increases surface area so that you have more area to exchange blood, waste, water. That helps to pull out more water, and basically the water and the waste go into the ureter and kind of come down to the bladder, right? So it goes through the tubule, and all the tubules meet back. They kind of branch into the ureter. Kidney disease is a low profile, unglamorous problem. It does disproportionately strike minorities and the poor. I don't see a lot of great studies as to why. I think the general inclination is less healthcare services, not that their primary care is often, possibly food, drink, nutrition could be an issue as well. Celebrity spokesman for a while was blue-collar comedian George Lopez. He received a kidney from his wife. Now, you do only need one kidney to survive, and so they both now carry one kidney. And for the most part, that actually does cure his chronic kidney disease. Different types of kidney disease. I'm just highlighting three. These are not the only three. I'm just highlighting these three. Chronic kidney disease, sometimes referred to as CKD, acute kidney disease or acute kidney failure, and kidney stones. Chronic disease. So on your far left, it's a progressive disease, typically stage 1 to 5. Total kidney failure happens stage 5 and beyond. That usually requires dialysis, potentially even a transplant. Acute kidney disease is different though, and this could happen at any time during your life. It happens for young people, it happens for older people. The three main causes we refer to as pre-renal, so before the kidneys, post-renal, after the kidneys, or intrarenal. There's something actually happening inside the kidneys. Pre-renal. You have a big drop in your blood pressure. You have hardly any blood pressure. You might be septic from, let's say, a pneumonia or a blood disease. And so your kidneys aren't getting enough blood. That would be a pre-renal acute kidney disease. Post-renal could be a urinary tract infection. A urinary tract infection that kind of goes a little haywire, goes up the ureters through the bladder, and actually now has caused kidney infection. Intrarenal often is toxins. It can be toxins. It could be drug interactions. It could be that the kidneys themselves are now inflamed. Inflammation in the kidneys could also do that. That's intrarenal. Normally, the way we deal with acute kidney disease is deal with the problem at hand. And kidney stones. These are literally exactly what they sound like. They are hard objects made from chemicals in the urine. That's the thing. They are actually made from the chemicals that go into the blood supply in your kidneys. So they can be calcium oxalate stones, uric acid stones, struvite stones, or cysteine stones. Uric acid, some people might know, associated with gout. Sometimes we have a medicine to deal with gout. Uric acid is that. Okay, acute renal failure versus chronic. There's lots of differences. Acute is an abrupt loss of kidney function. Chronic is gradual loss over time. The really important takeaway is that acute failure is often reversible. Chronic can be managed, but tends to progress over time. Often chronic can be caused by poor lifestyle choices, smoking, diabetes, problems that hypertension that's not medicated. Acute, not always that clear how you could have prevented it. If you get a crazy, pneumonia and you think it's fine and you let it go for a week, 2 weeks, 3 weeks, you might put yourselves into sepsis unknowingly, and now you're going to cause acute renal failure. So acute renal failure, we're going to deal with the problem at hand. Chronic, we're just going to try to get you to a healthier place so you don't cause any more damage. I did want to point out the labs we follow for kidney function: BUN, blood urea nitrogen. One of the two of the things we're taking out of the blood to clean it is urea and nitrogen, right? So if those numbers are elevated, if they're higher, we have a problem. The filtering system's not working. Creatinine, also, it's a waste product from cells. The normal is generally 0.5 to 1.2. I'd say for most women, they want it to be right around 1 or under. But again, it's a waste product from the cell. When that's elevated, you're not filtering well. And lastly, they use this estimated GFR. It's a filtration number. Normal is greater than 60. Do people walk around with 20s and 30s? They do. That could happen in an acute state. It could happen in chronic. It's not great. We're always going to try to get those kidneys functioning better. All right, expected treatments or management. So for chronic failure, number one thing, lifestyle changes. They're going to ask you to stop smoking, limit salt, limit alcohol, be more active, lose weight if you need to. There are medicines, but most of the medicines are going to control the associated problems. So if you have hypertension or high cholesterol, they want you to take those medications. Or heart failure. Heart failure is a problem with fluid balance. So they may need a couple of medicines to help balance your fluids. Dialysis, if you progress to stage 5, and you're looking at transplant, if you're stage 5 or further, and dialysis is not an option. Acute kidney disease or acute kidney injury or failure, they're always going to look to identify and treat the underlying illness or injury. What's causing the problem? If it's a bacterial infection, they're going to go after antibiotics, right? They're going to start a bunch of antibiotics and try to treat the infection. If they treat the infection, they should get the kidneys back working. If you come in dehydrated, they can start throwing fluids at you, right? If you're dehydrated, that could be another. Low volume is also going to hurt the kidneys. If you're in fluid overload, you have too much fluid, they might need to give you diuretics, something that's going to make your kidneys kind of push a little bit more, create more urine. Honestly, I have seen somebody in the ICU who had a bacterial infection. And I remember I was hanging the 12th bag of IV fluid. So it's the 12th liter of fluid. He hasn't peed in a day or two. And I look at the doctor and I think, this guy's going to explode. Like he's huge. Just puffy, there's fluid everywhere. And the nephrologist said, no, it's okay. This is just a fluid challenge. The kidneys, he's young, the kidneys will respond. Just hang the fluid. And sure enough, within a couple of hours, his kidneys started working. He started peeing. And within a couple of days, for the most part, his kidneys were getting back to normal levels. So it really does happen in the acute setting. Medications to balance potassium and calcium. That's actually very critical. We want to be able to balance potassium and calcium because those are pulled out during the process of your kidneys creating urine. And if we upset the balance, potassium is important for heart function. Calcium is important in 1,000 places, including mental status, like how clear you think. And sometimes we use dialysis temporarily. So we remove the toxins just to give you a break. We take out any of the extra waste, and then we wait for your kidneys to come back. So let's switch over to kidney stones. I had a couple of people talk to me about kidney stones, and some people even made comments on social media about how awful the kidney stone, their experience with kidney stones has been. These are the types of stones. We talked about the 3 kinds. I don't want to, they look pretty big here. Those are centimeters usually. And they're like little rocks, pieces of sand. That do get lodged. Sometimes they get lodged in your kidney. Sometimes they just hang around close to the ureter. The thing is, they can be painful. Trying to stick a small stone through a little straw, doesn't go. And if it backs up the urine, that's a whole nother problem. For the majority of stones, for the majority of people who have stones, dilution is the solution to the pollution, right? The stone's the pollution, dilution. No matter what type of stone, generally first mode of action, if it's early on, is to try to start drinking 2 liters of fluid a day. You want to flush them out. We know there's pain. We can kind of manage pain as well, but more importantly, we need the stones not to disrupt the flow of urine, and they most likely need to pass through your uterus, your down to your bladder, and out through your urethra. That's the deal. That's how we want them to come out. We don't want to have to do intervention if we don't need to. So they're going to try dilution first. However, if you're somebody who's been getting kidney stones frequently, or the type of stone is unusual, you should consider pursuing these tests with your provider, whether it's a urologist, who you probably should have if you've had stones more than once. What's your serum calcium level? Is it high for your age? It actually varies by age. If it is, why? That's a good question for your doctor. And I don't know is not actually an appropriate answer. The doctor needs to know or needs to find out why. They do need to give you a reason. And for somebody who mentioned this on social media, a lot of doctors do not look at parathyroid disease. And parathyroid disease can often be the problem when you're talking about calcium oxalate stones, too much calcium. And so the recommendation was that you get PTH, calcium, and vitamin D levels. And you actually ask your urologist, hey, is it possible this is primary hyperparathyroid disease? Because honestly, it requires getting rid of your parathyroid or some of your parathyroid, but that might be the actual problem that's causing recurrent stones. And if that's the case, you want to get rid of your stones. That's reasonable. So treatment options for kidney stones, if increasing fluids aren't working, lithotripsy is one way. That's non-invasive. They use sound waves to just try to break them up. It's a little bit like asteroids if you're from the 80s, so only they use sound waves. And they try to break the stone into a bunch of little pieces, and that hopefully it'll be easier to pass through that tiny straw and come out less painful. A ureteroscope, that's an endoscope that's inserted through the ureter to retrieve or obliterate the stone. Same kind of thing. They either go in and try to pull it out, or if they know it's too big, they blast it so it's tinier. And then now you got to wait for 9 small stones to pass instead of one big one. A uteral stent. So sometimes they put a stent in. So if the straw is tiny, one way to make it a little bigger is to stent it. So you put a little stent like we would for a cardiac procedure. And usually the stent stays in until the stone comes out. Once the stone comes out, then they take the stent out. They don't leave it in. And percutaneous nephrolithotomy, that is actually percutaneous. It means they're going to go through your skin. It means they're going to do some sort of actual surgery where they have to cut into you to try to get to the stones. It's very rare. But if they're large or complicated, if they're restricting your ability to pee, if they are, putting blood in your urine, if they are essentially making the kidneys unable to function, that could be a possibility that you might need that. All right, we're switching over to urinary tract infections, in part because urinary tract infections could cause stones, and stones could cause urinary tract infections. So left side, normal kidneys, to the bladder, to the urethra, right? No problem. However, on the right side, if you look, the bladder has inflammation, and often the urethra also has inflammation. And that's actually what you're feeling when you feel pain or when you feel the urge to go to the bathroom. It's the inflammation that's usually causing that feeling. I always like to start with normal. So what does normal look like? Normal urine, clear, no odor, amber, yellow, or straw colored. Average number of times a day, should be peeing 6 to 7 times a day in general. Adequate volumes, usually 400 mLs to 600 mLs. If you go to pee and it's like hardly anything, you got to wonder if something's going on. And there should be no pain, no pain. Signs and symptoms of a urinary tract infection could be a fever, but a fever is a late finding. It's something we know the infection has gotten too far along if you start with a fever. You might have a strong urge, a burning feeling when you urinate. You're urinating often, little small amounts, like every hour, and you hardly pee. The urine looks a little cloudy. There's blood in the urine. It looks pink, Coca-Cola colored, bright red. I mean, Any coloration other than yellow is not good. If it looks orange, it's got blood in it. Strong smelling urine. So plenty of urologists and nephrologists would tell you that they can tell when it's a UTI just by smelling. And pelvic pain. For women, this feels often like menstrual cramping. Causes of urinary tract infections, lack of water intake. Holding your pee. Now, holding your pee, not for an hour or two, but for half a day. For nurses, I can tell you when I get done with a 12-hour shift and realize I have not used the bathroom, that is a ding, 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 horrible warning sign. We have to take time to go to the bathroom on a regular basis. You should be going every 3 to 4 hours without a problem, except overnight. Some people get up during the night 1 or 2 times. That's not great, but holding your pee doesn't mean you can't hold it for 10, 15, 20 minutes. When the child who just went to the bathroom gets in the car and says, but it's not good to hold your pee, they're going to be okay. Improper hygiene. Wiping front to back for women, especially. Washing your hands. I know COVID's over. You still need to wash your hands after you go to the bathroom. Can't tell you how many people have stopped doing that. Wash your hands. Feminine products. Tampons are probably the one thing that they're talking about. If they stay in for too long, they can breed some not great bacteria. Diabetes, kidney stones, frequent sex. There is a body of thought that after sexual intercourse, it's a good idea to get up, pee for the woman, pee, wash your hands, things like that. It is actually a problem that we do see with frequent sex. Use of birth control methods. Certain birth control methods can increase the prevalence of a UTI, and that you should talk to your own doctor about. And pregnancy. Pregnancy, the issue is changes in pH and hormones, and that can typically make you more likely to have one. I always want to bring up seniors and urinary tract infections because seniors often have a different presentation. So I see this all the time. I'm on an orthopedic floor at my current hospital. So they analyzed 161 patients who went to the emergency room because they fell. And these ones were diagnosed with coexisting infections. Out of them, 44.1% had a urinary tract infection. Okay. For whatever reason, especially for seniors, urinary tract infections often present first as a fall or potentially no other symptoms, but mom looked fine yesterday and today she looks like she has dementia. I guarantee you she did not get dementia in one day. If somebody goes from being perfectly fine and remembering things, or at least at their normal level, to, oh my gosh, I have no idea what's going on with her. She's talking crazy. Please think about at least getting a urine test done. And remember, that doesn't mean an emergency room visit. That just means call the doctor, get an order, collect some pee and have somebody check it. It doesn't have to be even a visit. You could actually ask for an order to go to a lab just to do a urinary tract, just to do a urine sample. They'll be able to tell right from that. Ways to minimize or prevent urinary tract infections. Drink water regularly. So look, it actually says the goal should be that your pee appears something like the color of pale straw. That's pretty light. And that is a great sign that you have great hydration. Practice good genital and urinary hygiene, wiping front to back. Hate to tell you, but E. coli is the #1 bacteria that we find in urinary tract infections. There's only one place that E. coli lives, and it's in your GI tract. It's in your colon. It's not supposed to be anywhere near your urethra or your bladder. Okay? Ask a healthcare provider about low-dose vaginal cream. If you're postmenopausal, the vaginal skin, sometimes making sure that the vaginal skin is properly hydrated or rejuvenated to the level it was before, actually supports the presence of good bacteria. Good bacteria always fights off bad bacteria. That's a classic. They say a probiotic. We've talked about that with gut health. Cranberry supplements or 100% cranberry juice. Plenty of women especially say that cranberry really helps them. It has to do with pH, has to do with the flora of your bladder and your urethra. Know this, 100% cranberry juice, not easy to find. Most juices that you get, really look at them. Are they 100% cranberry juice? 100% cranberry juice on the back would just say cranberry juice. As soon as it says there's other stuff in it, it's not 100% cranberry juice. So just something to keep in mind. And this one, I came across this. I don't really know it as well. D-mannose. I guess it's a supplement, sticks to the bladder receptors that would normally attract E. coli. So the theory would be if you're taking the supplement, they would fill the spots so that E. coli would be less likely to take hold in your bladder. I just like this one. I get no UTI, you get no UTI, nobody. So that's the goal, right? That's always the goal. So having said that, my mission is to educate, empower, and partner with individuals and families to promote skilled and motivated self-advocates who can collaborate with their healthcare team. The idea of sharing this information with you is that you will be more able to have a constructive conversation with your doctors and your care team in case you have an issue. And even better would be that you could take this information to prevent an issue from getting established. So thanks so much for being part of this webinar. You can go back to it anytime on my YouTube channel at ReliableRN or at reliablern.com under webinars. Hope to see you next month.